interruption, so they have early period. Women who have late menopause, again, that is again indirectly related to possibility of obesity. Women with diabetes, these women are at increased risk of developing endometrial cancer. We see young girls these days with a condition called polycystic ovarian disease. Again, it's a very, very simple and common condition most of the girls will put. But what counseling has to be done is that PCOS is a metabolic condition. So that has to be identified and addressed well. Because if you don't nip it in the bud, then yes, tomorrow that girl may end up with an endometrial cancer later in life. So these are the two important, though the symptoms are there. With endometrial cancer, most of them they come to us with irregular bleeding. And I've heard patients telling, saying, my mother said, yes, it happens. The neighbor said it happened to her also. So what we are here to tell is that please let these women not ignore those subtle symptoms. If they are persistent, yes, they have to get it checked. So early detection. Now, if again, as I said, when there's a delay in diagnosis, it costs us something valuable, that is time. Time is very important because we can catch them early. If we miss that time, again, we can end up having these women in advanced cancer. Now, EndoCheck, why is that we have come up with this is that it is just not like any other lab test or anything. Here, we are going to have these women have a thorough consultation, proper history taking, and we risk prioritize them who are at high risk and who are at low risk. And we do a simple transvaginal ultrasound. Most of the health checks what are available, they do the reverse. They do a blood test called CA125 which can be elevated in various conditions, and then they come to us saying that they don't have an ultrasound but CA125 is there. So that's a very wrong way to do. So the best is again, as I said, a thorough history taking. Did you have early period? Did you have any polycystic ovary in your young age? Any cancers in the family? Did you have diabetes, hypertension? We evaluate the patient thoroughly, and then we kind of like advise them to have a transvaginal ultrasound. Based on what we find, yes, lucky enough, most of the time we do find if we do it correctly in a precancerous condition. So EndoCheck is just not a tool, but this is an opportunity for us to educate women, tell them what are the risks that they are, and yes, when we identify the high risk, we keep them under close observation, because it is not general. Once a year you do some blood tests and come back. Once a year you do your health check. No. High risk women, they need to be closely monitored because they may need an ultrasound once in 6 months and not once in a year. And this will happen only if there is a proper consultation and proper history taking. So our message to women is that do not ignore even a minor symptoms. Do not brush it away saying this is just a minor, everybody has it, because we really do not know who has a simple condition, who has a precancerous or a cancerous condition. So we are very happy that we are coming up with this initiative to take this bold step and to protect our women, educate them and screen them and catch them in an early stage, because we know when we treat them in an early stage, we have various options, especially young women, fertility preservation surgeries, or young women when they have early stage cancers. When we treat them, their lifestyle is much better than in the advanced stages. So I'm very, very privileged that we are initiating this, and I'll be honored that if you can go about and tell that every lady shouldn't ignore these subtle symptoms, and not to go to Google, but please go to a doctor and have a thorough consultation and proper evaluation. Thank you.
Thank you, doctor.